Okay, welcome everybody. I hope we can work really hard to keep you awake. I know everybody always gets a little tired after lunch and a big meal. So I just wanted to introduce myself and our panel and just know that this is going to be a really informal session and we're going to welcome your questions. So just to kick us off, my name is Helen Parsons. I'm an associate professor in health policy and management in our School of Public Health at the University of Minnesota. And I work a lot in the cancer survivorship space, trying to understand access issues for people. So challenges that people have with health insurance, other access to social support services, and how do we understand where there might be equity issues and how do we best get people connected to those services through the development of programs and interventions as well. And I am very excited. I have three wonderful panelists who I have had a chance to work with and in their organizations over the years. The first is Lindy Yokanovich, who is the founder and director of Cancer Legal Care, a wonderful organization here in Minnesota. We also have Dr. Arjun Gupta, who is a gastrointestinal medical oncologist and assistant professor in our School of Medicine at the University of Minnesota Medical School. And then last, but definitely not least, we have Shandy Mangra, who is the Health Equity and Community Outreach Manager at the Angel Foundation here in Minnesota. So as I said today, actually, before we get started, I was reminded that we have a number of people online and we wanted to welcome you to this session as well. And please know that if you have any questions throughout this panel, please be sure to put your questions in the chat. And we will be sure to answer those as we go along with our panel. Okay, so to kick us off, what I wanted to do is kind of ground us in some of the terms that we'll be using. Sometimes we use a lot of these terms around financial and logistic toxicity interchangeably, and they can oftentimes be confusing. And so I just wanted to kind of orient us to when we say different terms, what we mean. Now, throughout our discussion today, let's see if I can get this to work. Well, that's okay. It doesn't matter. Could we go maybe to the others? Thank you. So the term financial toxicity has really developed over the past decades, and it's just a recognition of the financial burden that individuals, as they're going through and interacting with the healthcare system, that they might experience. And cancer survivors are really kind of at the forefront of this, where they're experiencing, sometimes the term is financial hardship, financial toxicity, but just a recognition that there's a lot of out-of-pocket expenses that individuals experience during their cancer journey, whether it's, co-pays from their medications, co-pays for some of the surgeries that they received. And it goes really beyond that to think more broadly. And I think as a field, we really developed over time that it's not just the care that you receive that you might experience costs associated. It has to do with the fact that potentially you might not be able to work as much as you're going through your cancer diagnosis and treatment. And if when that happens, potentially that might mean that you would lose your insurance and the costs associated with that. And when you're not working as much, maybe there's not as much income coming in, but it's not just for you, it's also for other members of your family as well who might be supporting you on that cancer journey. And so over time, as this concept of financial toxicity has really developed, there's been a broader development in the literature and just recognizing that there is a big impact on the well-being of individuals and their caregivers as they go through this journey. And if we could just go to that last slide, please. And just recognizing that we need to address challenges with financial hardship because they do have a long-term impact on both the mental, the physical, and the social well-being of individuals. And so that is why our panel is here today, is to really bring some recognition and some better understanding of the financial challenges that people experience, as well as some of the wonderful resources that we have within Minnesota for people that are walking in this on this journey. So with that, what I'm going to do is to kick off our panel, just ask a question, but please be thinking about questions you might have yourself that you'd like to ask of the panel, and we'll go to questions in just a moment. So to start us off, Dr. Gupta, if you could just tell us a little bit about yourself, how you got interested in this topic of financial and time toxicity, And maybe just tell the group a little bit about what you found in your research around some of the challenges that people experience.
Thank you. Good afternoon. Welcome, everyone. It's a joy to see all of you. I'm a medical oncologist, so clinically taking care of persons with pancreas cancer, colorectal cancer, liver cancer, gallbladder cancer. And I've only been a faculty or full-time practicing oncologist for the last couple of years. I think that's enough time to experience what patients with cancer are going through and also their care partners. So I'll start off with just a couple of stories about the financial burdens that people with cancer are facing. And I'll give two examples of medication-associated costs, but we can think about those in the context of everything else that people have to pay for. So this is actually a very close personal friend who, when she was 28, her husband was diagnosed with advanced GI or gastrointestinal cancer, very aggressive. And she became a sort of full-time care partner to her husband. The husband was receiving very aggressive chemotherapy and frequently had nausea. And there's decent drugs to treat nausea that we have now. My mentors who practiced oncology in the 1970s told us in training that, you know, when we would run into a patient in the mall, the patient would throw up when they saw the oncologist. That was the association between nausea, vomiting, the oncologist, and chemotherapy. No one has ever thrown up seeing me. And that's because we have access to really good drugs now, right? But this lady was with her husband in the car, picking up a nausea prescription, urgently prescribed by the oncologist. She drove to the pharmacy in the rain, parked, went into the pharmacy, got the medicine. The copay, or the amount you have to pay out of pocket for each prescription, was $37 per nausea pill. Think about that. $37 per nausea pill. And this is not a fancy new medicine that just came out. This is not a brand name medicine. This is a generic medicine. So there's lots of reasons about why drugs are so costly, but let's focus on my friend for now. You suck it up and you pay for 10 pills because your husband is nauseated in the car. And you take these pills back to the car and immediately give it to him. But he's become so nauseated at this point that he actually throws up outside the car after taking 2 of those pills. And can you imagine even having to think, should I look into that vomit to see if I can salvage those 2 pills that he's just vomited up? Because that's $74 right there. This is the state of cancer care in America today. This is a few years ago. And I'll tell you another story, if this one wasn't horrifying enough. We often diagnose people with pancreas cancer when they have stage 4 disease, but sometimes we're lucky and we diagnose people when they're earlier stage where we can cure it. This gentleman in his mid-40s was diagnosed with pancreatic cancer, received 6 months of chemotherapy, went on to get a pancreas cancer surgery, which involves removing most, if not all, of your pancreas. And patients are then dependent on insulin for the rest of their life because your pancreas produces insulin. And just as historical context, in the 1920s, when insulin was first discovered and licensed, Dr. Banting in Toronto licensed insulin to the University of Toronto for $1 and said, this medicine belongs to humanity. The average out-of-pocket costs for insulin for people with cancer in the US is $220 per month. And imagine a 40-year-old, otherwise fit person having to pay this for the rest of their life. So it's in this context of incredible financial burdens, not just by medicines, but everything else that persons with cancer face, that we start to think about financial toxicity, which is nothing but the detriment in quality of life experienced by persons with cancer and their care partners because of the excess financial burdens, right? And maybe 15, 20 years ago, this term financial toxicity did not exist. So it was coined around 2010 by some oncologists at Duke University. But before that, this financial burden, this financial toxicity of cancer care was just recognized as a side effect of treatment, and you had to live with it. Or you're going bankrupt, no, that's par for the course. Your out-of-pocket costs are $80,000. Well, I'm sorry, it sucks. This constant battle between your life and your life savings is not new. It's been going on for decades. But the recognition that this represents a preventable and actionable cause of burden to patients and care partners has perhaps only come out in the last 10 or 15 years. So as we start thinking about financial toxicity, we've sort of developed measures to understand how much burden patients are facing, and have also developed interventions, which we'll talk about, on how to address these financial burdens. And more recently, in the last couple of years, our research group and others have developed a couple of parallel concepts that take into account the burdens that patients and care partners face. One of those burdens is logistic toxicity, which is just a fancy way of saying that getting cancer care is freaking hard, right? It's all those annoying phone calls with the insurance company. It's the paperwork to get FMLA. It's waiting at the pharmacy because your medicine was sent to the wrong pharmacy. It's all of that mental, physical, emotional toll in getting the cancer care that you need. So financial toxicity we touched upon, logistic toxicity, and then the third pillar that we're developing alongside is time toxicity, which is that patients' time is perhaps the most precious resource that they have. This is applicable to everybody, but perhaps most so to people with advanced cancer who have limited time to live. And modern oncologic care, modern cancer care is becoming more and more complicated, requiring visits to the infusion center and a scan and a lab. Oh, but we need this thing monitored, and oh, I need to get admitted to the hospital. And how much time that takes away from patients and their care partners, right? So we're purposefully developing these three pillars together, financial, time, and logistic toxicity, to recognize these as concrete side effects of cancer treatment so that we can better understand these and then intervene upon these.
Thank you for that great overview and the challenges that we have. And so maybe we'll transition a bit here to Lindy, if you're okay, we'll start with you to hear about some of the opportunities we have to address some of the financial hardship that individuals with cancer can sometimes experience. Would you be able to tell us just a bit about your organization and the types of services that you provide and how people can find out about your organization?
Hi, everyone. My name is Lindy Yokanovich, and I'm the founder and executive director of an organization here in Minnesota called Cancer Legal Care. And we are here to help with all of the practical legal issues that Dr. Gupta was just identifying in that backdrop. So imagine, that couple going to the pharmacy, the wife trying to take time off under the Family Medical Leave Act as a caregiver, not understanding how that works, getting some pushback from her employer, to her husband who's unable to work during his treatment, not sure about his rights as an employee, worried about if and how he's going to be eligible for Social Security disability, how to even begin doing that process. And then so many of the other issues that come up with the financial part of cancer, trying to deal with debt, trying to keep, paying for your kids' braces, trying to pay your mortgage or your rent, all those types of things. And so your care team is a great place to sort of take those concerns. But, we hear from a lot of doctors who say, I'm when somebody tells me they can't make their mortgage payment, I just am like a deer in the headlights. I don't know what to do. I can tell them the right kind of medication they should take for their cancer, but I don't know how to save their housing. And so that's where Cancer Legal Care tries to come in. And we're a group of a staff of 7, a board of 18, and about 70 volunteer attorneys around the state who for the last 15 years have been providing free legal services to cancer patients, survivors, caregivers, anyone affected by any cancer anywhere in the state of Minnesota. And all of our services are at absolutely no charge. And we do this because all of us have been either cancer patients ourselves or love cancer patients and know that these issues are pervasive. It doesn't matter how great you think your job is or how wonderful you think your insurance is if you're facing a denial for your child's cancer treatment. It's a lonely, lost, terrible feeling. And so that's what we do is try to help with those issues. And mostly people hear about us from their social worker at the cancer clinic, but not everybody sees a social worker. And so, you know, my one ask of all of you today is if when you're talking to folks in your support groups or that you meet at the grocery store and they, you know, they need help, please let them know that there is help. Cancer Legal Care, Angel Foundation, there's a wonderful network of care, Jack's Caregiver Coalition here in Minnesota, really here, and we're all connected with one another. And so it's really just coming into one of our organizations to try and get the whole help that you and your family need. We are right next door. So at Cancer Legal Care, we always, you know, we're always saying we always try to say yes. So, but we're lawyers, we're only licensed to practice in Minnesota. So, and the laws just across that St. Croix River are wackadoo crazy, totally different. So that said, you can always feel free to reach out to us and we will try and help you find the resources that you might need in Wisconsin. Sometimes there's a lot of folks who live in Wisconsin, but maybe work in Minnesota and have an employment problem that we can certainly help with. But in terms of helping with insurance appeals or estate planning, the laws are different. So we can't do that, but we can try to help you. Right. Right. The law here, the employment law would, yeah. So just give us a call and we'll try to figure it out.
Good afternoon. My name is Shandy Mangra, and I am the Health Equity and Community Outreach Manager at Angel Foundation. Angel Foundation has been around for over 20 years, providing relief to adults and families that are impacted by an adult cancer diagnosis. We support through 3 programs. We have our Emergency Financial Assistance Program, we have our Financial Cancer Care Program, and then we have our Adult and Family Programs. Primarily, the 2 programs that help support addressing sort of financial toxicity around immediate to sort of long-term needs are our Emergency Financial Assistance Program and Financial Cancer Care. So a little bit more about Emergency Financial Assistance. It's an important resource for families and adults going through a cancer journey by providing a one-time grant for non-basic medical needs. So we support families needing support around mortgage, rent payments, utilities, gas, and food. We just added, because of out of a need, we were surveying clients and found that there was a need for car repair, car payments, car insurance. So we've just added that this year. And we serve the 11 county metro area as well as St. Louis County up in northern Minnesota. And that is folks that are living in and treated in our service area. So that sometimes we get folks that are out of state. It sounds like some folks coming from Wisconsin. And with emergency financial assistance, you do have to be in an active cancer treatment. But with financial cancer care, that's supposed to sort of address more of the longer term needs that we are seeing as we're talking about financial toxicity. It doesn't end after a treatment. It's ongoing and very pervasive and often affecting decisions around, family planning and college savings and funds like that, examples like that. So with financial cancer care, it is designed for individuals that are up to 2 years out from their cancer treatment. It's to provide sort of a two-part component. It's one, you're going to meet with a social worker and a certified financial planner in a workshop to talk about virtually for an hour, talking about sort of building the foundations of a financial well-being and house. So you're basically talking about from the basics of the budgeting to addressing what assets you have, what are the financial concerns and debts that you're carrying, and then going from there. There's a second part to that financial cancer care program, which is meeting with a certified financial planner. And depending on the needs of the client, you can meet with a certified financial planner. And this is pro bono certified financial planners that we partner with Ameriprise to provide this service. And then again, it's depending on the need, they might meet with them for 1 to 3 sessions. And oftentimes we do often hear there are barriers to getting into these programs, often due to the fact that people feel like they don't have disposable income, because that's what we're talking about here is there's not enough money to go around. How am I going to make ends meet? But actually in a time where it feels like you really don't know where your money is coming or going, that's actually probably a really good time to sit down with a certified financial planner and just review your accounts and making sure that you have somebody else who's also looking at things and can help you sort of feel a sense of relief. So we're not just addressing financial toxicity here. We're talking about addressing the social, emotional, and the mental health aspect to this journey, seeking cancer treatment and care. Our last program is adult and family programming, and it is designed to help support adults and their families with education, evidence-based education, as well as opportunities for them to enjoy a time out, get away. Oftentimes families lose sort of the fun money goes out the window. They don't have money, dispensable money for spending on the family. So we do offer tickets and other opportunities for folks to go out into the community and spend that time with their caregiver and with their family members. So oftentimes folks hear about Angel Foundation, similarly to cancer legal care, through the healthcare system. You might talk with a social worker who gets you connected through our application process. You can apply for all 3 programs in one application. We try to make it as easy as possible for folks to access our resources. So oftentimes that is the case, but part of my role as a community health outreach manager is to go out into community sites and actually let folks know about the resources that we provide. Because oftentimes we're seeing that, again, some folks don't have the same access, there's not that many, there are social workers in the healthcare system, but sometimes there's not enough navigators. There's not enough one-to-one opportunities for folks to connect with individuals in the healthcare system. So it's very important for us as community organizations to get out and be able to offer our resources and let people know about this information and help and assist in applying for the resources. So those are various ways in which people find out about us, and also word of mouth. So definitely hearing more information about all the great, wonderful organizations that are here today, to be able to pass that on to somebody. You never know who in your life also will be affected by a cancer diagnosis. So yeah, wonderful to be part of this panel. Thank you.
Thank you all for sharing those resources. Just to start off our discussion, I'd like to ask each of you to share any advice that you might have with individuals or caregivers that are trying to navigate some of these social and financial services after a cancer diagnosis. What kind of advice would you give?
Sure. So the short advice is, please be honest and upfront with your clinical care team, with your oncologist, about burdens that you're facing. And the broader explanation of this is that each patient's burdens, each patient's financial toxicity, or what is causing it, can be very, very different. The healthcare system is very opaque. How we cover or pay for care is very, very opaque. How much it costs for one patient to get drug X is very different from what it costs patient B. And no one, even your oncologist, may not know how much that particular aspect of care is going to cost you in that moment. However, it is very important to communicate what is bothering you and what is bothering you the most to your clinical care team. Because more often than not, there's many alternatives in oncology that exist. It's not just that this is the only treatment that exists and we have to pursue this. There are often equal alternatives with widely varying costs. That example of the $37 nausea pill that I gave at the beginning, there's nausea pills that cost 50 cents. There's nausea pills that cost $1,000. And these can vary from not just your insurance, but what phase of insurance, what part of the year, January or December, that you're in. So just letting your clinical care team know that this is what is bothering me is going to help them to try and help you out. For some patients, their insurance coverage may be excellent. Their out-of-pocket costs may be zero. So for chemotherapy, for CT scans, for a hospital admission, for a procedure, for a biopsy, they may have to pay $0. But paying for childcare, because their appointments are always in the morning, and that doesn't suit their day, may be causing them the most distress. For someone else, it may be that coming to the Minneapolis main campus is a 70-minute drive, and nobody said, can I get this chemotherapy in Burnsville? So being honest with your oncology care team, being transparent, is perhaps the shortest piece of advice that I'll give. The biggest concern that we hear from patients and care partners is, if I do this, then my care will be compromised, or it is not my oncologist's job. And that is patently false. I think we can only improve the care that we deliver when we know what's truly bothering patients, and we can actually leverage the resources that exist only when we know. So in short, please, please, please tell your oncologist. And I truly believe that most oncologists are good people. We're short on time and working in an imperfect system. So keep shouting, I have trouble paying for my care, I am having trouble, and people will listen.
I guess my advice would be prepare to be aggravated, because it is aggravating. Every single one of these issues, you feel alone, you feel isolated. This is only happening to me. And you hear a no, and you think that's the end of the answer. And I just am here to tell you, it's not just you, it is everybody is facing some level of this kind of issue. And to not take no from somebody who doesn't have the power to say yes. So if you ask for some help and someone says, oh no, we don't do that here. Okay, fine. You just clearly don't know all what you might do here. Go ask somebody else. And at a time where you need to be supported and you need help and you want the cavalry to rush to your side and take care of you, you're often called on to be your strongest, best, most strategic advocate you can be when you're absolutely exhausted, nauseous, throwing up, sad, frustrated, all these things. So I think the key thing is there to realize it's often not personal, even though it's entirely personal to you, what you're going through. The reactions that you're getting from your insurance company are super not personal, I'll tell you that. And sometimes you just need an advocate, and that can be a family member, that can be a friend, that can be a coworker, that can be us at Cancer Legal Care. But I really think your primary advocate is going to be your healthcare team. And to have, I'll tell you that not all doctors are as wonderful as Dr. Gupta here, but that doesn't mean that what they're telling you in terms of getting assistance for these different things isn't valid and worthy. So keep asking. You know, if you have a friend who's really good at asking questions and they're asking, what can I do to support you? Tell them, I need you to come and I need you to find all these different, this is what I'm struggling with. And then figure out, you know, have somebody else try to figure out where those resources are. But I just think that so many people are just like a deer in the headlights when they get a diagnosis and they're dealing with all the physical and emotional piece. And then you hear, oh, you're not entitled to FMLA leave because you just changed jobs and you haven't been there long enough. And oh, by the way, it's unpaid leave, and you've got to figure out all these different laws. And then your insurance is denying your care, and it's just too much to deal with. So there is help out there, even though it feels very much all on your shoulders. There's a wide community of help here, especially in Minnesota.
Those are all great takeaways. So honestly, I would just honestly reiterate some of these points is identifying who your trusted network is, your healthcare team, your family, your friends, potentially even folks in your workplace. Having as many folks that you trust kind of aware of your situation. And I think it's really to say lightly, to talk about financial concerns and hardship is not easy. And I think there's a lot of stigma actually about talking about money and like in general, and especially when we're having a hard time and incurring debt and things like this. It's a very difficult topic to bring up. But I think the more that we talk about this, because as we're saying in this session, it is a huge concern for a lot of survivors and patients. And so I think it's important for us to recognize that and be able to say, as you tell your story, more people find that they can understand what's just exactly what is happening, and maybe we can advocate for more changes to be made when addressing financial toxicity. I would also add that it is that you deserve to feel supported, and sometimes it's hard to ask for help. So we had a survivor and volunteer for Angel Foundation who tells the story of when she went in and found out she had breast cancer. She, walked out really stunned and just didn't know what to do. There was a receptionist at the desk who looked at her and said, "Hey, did you get connected with the social worker? If you need any resources, if you need support, they're there. We can get you connected and make an appointment." She hadn't even thought about that, but she felt, it was a woman that looked just like her, came from same walk of life, and immediately went, maybe I should. She's telling me it took a little bit of encouraging. It wasn't an immediate thing. So it took a little bit of encouraging from the receptionist, but because she was so kind, she was offering support, trying to get her connected to the social worker. She inevitably did meet with the social worker, who then actually connected her to Angel Foundation, and now she is a volunteer and trying to get the word out about our resources as well, because she had no idea that we existed. So it's just wonderful to hear. But I would like to bring that example up because even she just had so much, she felt so much pride and didn't want to ask for support, didn't feel like she needed it. And there might sometimes feel like there's a little bit of connotation to receiving support like this, free services and programs, but it's there for you, and it's important that that you deserve to seek out that support. And sometimes we just need a little bit of a prod from other folks, but just never forget that there is support out there, and there's a lot of organizations, folks can call us, and even if we aren't able to provide the resource, we are going to get you connected. Like the number of times we've referred folks to cancer legal care, we can't even count on our fingers. It's a lot. So it's important for folks to feel like even you just reach out. You never know if someone has an answer, and if not, we will try to get you something, point you in the right direction.
So at this point, I wanted to open up the floor for questions, either in the room or if there's any online questions that you might want to ask the panel. Yes. Oh, here, we'll have you use the microphone so people online that way people online can hear as well.
Yeah. Okay. And I think a lot of people can probably relate to this, but I just wanted to reiterate what they said. Sometimes you get through the immediate storm of cancer and a lot of those big bills right away. But a lot of in this room probably, you go in for quarterly checkups afterwards, and that might include blood work, and it might include scans and oncology appointments. So, even when that immediate storm maybe passes, the bills don't necessarily stop. A lot of cancer patients, you're going on for 5 years, right? You might go quarterly for a while, then you go, semi-annual, and you get on to annual. But I think it's really good what they're talking about here. So you plan, because it is a long burden, and maybe some of those financial bills diminish a little bit but it's a lot of years, before they go away. And if you heard me this morning when I was talking, and I'm very lucky, and I thank every day that I have great insurance. But if you heard me this morning talk about, like my kidney stents from a result from the radiation, and it's just what it is, but they're $24,000 every 50 days. So, and again, I'm in a, good position with health insurance and stuff, but it's $24,000 every 50 days. So, and that's the rest of my life. Right. And then I have ostomy supplies that are $5,000 a year and things like that. So, like I said, a lot of people, when the cancer ends, maybe, some of those bills end, but for a lot of people, it goes on quite a few years. And so I think what you're doing is great to kind of plan that some of those things are going to be present in some way or form for a while. Maybe not to the extent of $24,000 every other month, I hope, but.
Oh, we have a question here. Here, I'll bring the microphone this time. We can flip flop.
I just have a really quick question. I know this is the University of Minnesota, and my question is logistical. What is being done to help people get through the system? If somebody wants to go to the university, how do they get there, and what is there anything being done to kind of speed up the process?
I think there's some history behind this question. No, I don't know the context, and is it more referring to the speed at which we can access cancer care? Is that right? Okay, understood. Well, I will give you my personal email, and please reach out to me anytime, because the healthcare system is overburdened and imperfect and broken, and there is no denying that. I've practiced at several different institutions in the US, and I can say that each one has its own unique struggles. It shouldn't come to individuals to try and go above and beyond to make sure people can get the care that they need. But unfortunately, that's where we are. So I cannot make any promises about how quickly your phone will be answered. But if you email me, if I don't get back within 24 hours, please call 911 because I'm in trouble.
And I just wanted to add an extra addendum to this, is that, there's a lot of talk about networks and shrinking networks, and depending on what your insurance is, where you can go for care. So for instance, if you're buying insurance on the individual network, you cannot buy your way into treatment at the Mayo Clinic. So, for these small business owners who, don't have a big group health plan, they can't get down to Mayo through insurance. And it's a real challenge. So there was just some legislation that was passed, went into effect last year, called the No Surprises Act. You might have heard about these gotcha medical bills. We had a client who, the week after his wife died, he was hit with a $165,000 bill because the care for the last 2 months of her life was with a doctor who was in network, but at a facility that was not in network, and no one ever told him that. So he called us saying, if you can't help me, I'm just going to, I guess, put a for sale sign in my yard. And we were able to work with his insurer and to get the entire thing covered, and his final bill was down to zero. But that exact scenario is what's meant to be covered by this new No Surprises Act. But not all the insurance companies are up to speed on this. And so that's, again, where it's incumbent on all of us as citizens, taxpayers, voters, to know what's going on and to become more active in advocacy and system change and policy change. There's so many reasons, so many laws that are inequitable and don't make sense on the books that lead to financial toxicity. And probably one that lots of you are familiar with is the 5-month wait for Social Security disability benefits to kick in once you've been deemed totally and permanently disabled. There is no good reason why there is a 5-month wait, none. But we see it every single day where people who have stage 4 cancer cannot quit working because they can't bridge that 5-month gap, even though they're eligible. So just to say that another part of this, it isn't just on the health system, it's the entire, the laws and everything that need to be changed. They're slow going, but it's the most profound way to make big changes.
I'm just going to make one other comment and then we'll go to your question next, is that the way that we get rid of these barriers or start to break down these barriers is by having people tell their stories around the financial challenges, the insurance challenges. And, you know, I think I would say if there's like a slight glimmer of hope, I think we are seeing some changes. Just as an example, I was involved in some discussions with some recent legislation that was passed in the state of California, which helps different types of cancer survivors have access through requiring certain insurance companies or types of insurance to cover access and a second opinion at different types of cancer centers so that they don't run into those surprise bills. And it's by telling the stories, that's what really helped to bring that to the forefront and that legislation to ultimately be successful. So don't forget that your stories are important, and that only by hearing those do we see change happen. So I think we'll go to your question next.
Could you just repeat what you said, please, about Mayo Clinic and getting there? And it's been a few years now, but I did refer one of our board members to your organization, and what she was told about her drug coverage was not transparent at the U, and she ended up in major debt. And I'm not sure where it is now, but you do anything retroactive, how far back do you go? And then again, the question about Mayo.
No, I'm sorry for your friend, and she can certainly contact us and we can see how far back we can go and look at that debt and see what can be done. My comment about Mayo is that the people don't always have access to every single system. So based on the insurance that they have. So the smaller your network of choices of where you can go means that you're probably going to pay less for your premiums, but you're going to have a smaller choice of where to go. 98% of the state probably has access to Mayo, but for the small group of people who don't have coverage through their employers and aren't on Medicare, but they have maybe, you know, they're a small business owner or something like that, and they're buying insurance on the individual marketplace. You can't buy that coverage. So the coverage is very different for where people can go, where they live in the state, and where they're and what their insurance coverage is going to happen. So, you know, not everybody's going to have access to Fairview. There might be at another provider. So that's what I was saying.
Thank you for this excellent presentation. I'd like people to talk a little more, since this is a survivor conference, about people who have thrived for many decades following a cancer diagnosis, but have a problem list very long related to that. So I do have a history behind this question. My mother's 92 years old and a survivor of uterine and a fairly benign ovarian cancer, but she needed radiation in the 1980s to ensure survivability, and it's worked well. But she has Apoitin deficiency anemia, she has thrombocytosis, she has chronic kidney disease, she's had bilateral hip replacement, and a few other things. I forget how many problems she has. And it's, you know, really hard to navigate the system and meet her needs. And what I'm feeling myself is more logistical toxicity. I can spend hours on the phone trying to get, you know, people into her home and managing the clinic appointments and transportation. Oh, she has, yeah, she's walker dependent as well. And I'm also working on getting her into a memory care facility from independent living. But what kind of, so far, it's not financial toxicity, but do you have any suggestions? I also want to say it seems to be really hard to get a social worker as an outpatient, to get an hour with a social worker. Sometimes they don't even return their calls. And when they do, it's to get 10 minutes out of them is kind of tough. So kind of a long, broad ranging question, but thank you. That's my experience.
Well, I think I'd just like to start off by saying thank you for sharing your experience. One of the ways that I bring light to some of these challenges, which I mean, I would assume it, I'm not going to assume, like I know just from the research that's emerging that this is a really broad problem, and it's not just a small subset of individuals. And I think that the way that we move forward with it is bringing recognition. And I think that the term logistical and time toxicity are really kind of new and emerging. And that the more that we can bring awareness to it, kind of on a system level, the easier it is for us to come up with solutions where there are actual resources behind it to support the social workers, the patient navigators that we recognize and have recognized for some time now are real challenges, in that they're just under-resourced in not just one health system, but the health systems across the country. And it has to do with how those services are paid for in our healthcare system. So the first step really is to continue to share those stories, to bring them to the forefront so that we can actually change the way that we pay and support care in the United States.
And I'll say this, so it's easier for us at the clinic to prescribe and get a $50,000 drug covered than it is to arrange a walker for a patient who really needs it. And that tells you everything about how things are reimbursed and set up. From a clinical perspective for the individual patient, this is more frustrating than I can imagine. I unfortunately do not have a magic solution. Like Helen was alluding to, social work, all of these ancillary services just do not get the money that they need, and that's why they're understaffed. They are working as hard as I've ever seen them. And our life in clinic is impossible without them. And so this purposeful inefficiency of the healthcare system, which is actually developed in that way by major insurance companies and payers to avoid doing to actually delivering the necessary care, is what prevents this. So there's many structural barriers that we need to cross. And I think we will get there in decades. It's through such forums that we build stories. We build stories and develop a measure of logistical burden. So we say that cancer survivors in the US are facing this level of burden, and then enact intervention. So it may be 10 years ago. So when your mom is 102, maybe we will have the answer. And the second point I'll say is this forum today is specifically called Cancer Survivorship. And I know Dr. Blaze and the organizing committee have been very intentional about that. The NCI, the National Cancer Institute, says any person diagnosed with cancer that time onwards is a cancer survivor. Many times in clinic, when someone is newly diagnosed with cancer, but we're not sure if they're fit enough or strong enough to get chemo, I actually put in a tentative chemo plan in the computer. So in the health system's mind and the insurance company's mind, this patient is a cancer patient who's going to get chemo, and all these other supports can then be used. That bias that you're raising about people getting active cancer treatment, perhaps having more support. And you're right that it starts to disappear, like Mike was also pointing out, after a number of years. So I'm hopeful that as we broaden our purview of cancer survivorship, support for such long-term survivors will also improve.
Any other questions? Or do we have any online? Okay. We have about 5 minutes left in our panel. So what I would like to do is just ask a final question of our panelists. And it's just really simply, what is one takeaway that if people bring nothing else away from this discussion we've had today, what would you leave them with?
I think I would leave folks with empowering folks to tell your stories and continue to share, because a lot of folks don't necessarily know what that experience is like, and everyone's experience having gone through this journey is going to be different, right? So it's important for us to be able to share what that is like, and what are the ongoing concerns impacting you, impacting your family. I think it is vital. And just kind of from the previous conversation that we just had, I actually mean to mention that one of the things that Angel Foundation is sort of moving in this direction is getting other folks involved in the conversation. It shouldn't just be on patients and survivors to be talking about the impacts of financial toxicity, the mental and physical strains on them. We also want in a conversation we're going to have coming up in May, it's going to be a conversation with employers. It's going to be a conversation with HR personnel to talk about some of the concerns that Lindy mentioned about, health plans. There's some employers that don't really have a full understanding of what their health plans, what exactly in the health plan is covered to support cancer treatment. And so for helping employers navigate alongside of folks who've been diagnosed, who are in the workplaces, who depend upon employer provided insurance, helping them navigate and have conversation, because for many, it's new for them as well. And they need to be able to understand where they can come in alongside and partner with that employee that is going through that journey, so that they're not alone, and then they can create a transition plan and other things. So that's something that we are just now having a conversation about. And I think it's continuing, as Helen mentioned, to push the conversation forward by telling your stories and making sure that it's being heard by the right people, right? So I feel like it's a newer conversation that it's been around, but I think more and more we're having there's interest in the employer space to understand just how impactful cancer diagnosis and the treatment is on the employees, as we are seeing more survivors living much longer. And I think it was like 18 million survivors in the US. So it's an important conversation.
Thank you. My one takeaway is to get very comfortable in saying the words that will come to your oncologist. So we're going to practice together. I have trouble paying for my care. It's okay, and it won't affect how you're treated. So I have trouble paying for my care is very powerful. Most people in medicine went in for the right reasons and really, really care about you, and they will act on this.
And I would just remind folks that you don't know what you don't know, but there are people there who do know and want to help. So if there's something that's keeping you up at 2 o'clock in the morning, worrying, I can almost guarantee that's something that Cancer Legal Care can at least help with, or at least shed some light on, or at least get you pointed in the right direction. So don't be afraid to reach out, and really there is no shame. There is no reason to feel alone with these issues, because they are happening everywhere to everyone at different degrees, but it is not for the faint of heart, these issues. And it is really time that they're getting the light shed on them that's needed to bring the change. So please tell folks about the great cancer survivorship community here in Minnesota. And really, any place you jump in, there'll be a referral for you and some guided help for what you need.
So with that, I guess I'll share my piece of advice, and it's just that you're not alone. I know that this can often feel like a very lonely journey, But I hope that in bringing this wonderful group of community resources, and this is really just touching the surface, hopefully you'll have a chance to stop by a lot of the other booths of other resources that exist to help encourage you and that you're not alone, that there's a lot of people here that really want to work to help support you through this whole journey. So thank you thank you.
I tend to have a voice that carries anyways too. But my question was, so I've used the Angel Foundation. Thank you so much. I have heard about legal cancer care. Thank you for being there. I know you've helped other people, and I really resonate with what the doctor is saying about communicating clearly about your situation. We all have unique situations we need to make clear. My observation, though, has been when you get to the really big picture financial issues, like paying your mortgage, making the decision about, taking all the money out of a health savings account and being depleted within a matter of a day with money that you've saved for years, kind of thing. This kind of the big picture money. Are there any organizations that help you navigate through that? Example given, when I got my diagnosis, I immediately called my mortgage company and said, there may be a month or two where the payment is late, or, as I'm communicating to my niece to pay the mortgage, she can't log in and I'm too sick to give her the password, kind of like, what's the deal? And their only response was, well, we'll only come after you, when you're late. I'm like, well, I'm trying to be proactive here. Is there a way you can flag it? So are there any groups that address kind of how to talk to these institutional places, to get them up to speed and, make them get their, what together to deal with people in these crises?
I have no idea.
Well, I know Angel Foundation's program, the Financial Cancer Care Program, does that with financial planners. The Financial Planning Association of Minnesota also has financial planners that will look at your larger picture and, help you make those decisions. Is, do I sell my home and, take that equity and buy something smaller, that can really delve into those bigger pictures. And that's really the profession you'd want to have you help making those decisions. And in terms of, I've also heard almost the same story from you about your mortgage company, where the mortgage company was like, that's great, we have a certain program for that, and let me put you in touch with somebody who can do that. So I don't think there's any consistency across those big providers. I will say though, that if you are struggling to pay bills, don't just not pay them, pay something on it. Contact them and ask if you can lower your minimum payment. Do something like that, because if you can just keep doing something, that's better than just letting those past due notices pile up and then getting referred to a collection agency. So some places are more proactive. The person who answered the phone there might not be the right one. So that was my thing, like hang up and try calling somebody else or a different, with all of your free time and energy. That's, unfortunately, I don't know of any sort of clearinghouse of good information like that.
And to your point about big decisions, I think from the clinical side, one thing that I'd like to encourage is almost cornering your oncologist if needed into having good discussions about prognosis. How much time do I have? What is the expected benefit of this treatment? I know a lot of people in the audience today might be longer term cancer survivors where we're not facing an imminent death. A lot of times though, patients are forced into making these decisions of should I sell my house, etc., without understanding that their time may potentially be limited. So having that context of how much time do I have to plan for all of this is essential. So communication is, I think, critical for patients to be able to make the best decisions for themselves.
Are there other questions? Oh, we just have to have it on the microphone so that people on Zoom can hear.
So my son was diagnosed in 84 and we weren't given a social worker. There was nothing. Make-A-Wish was like just beginning and even they were limited. So we kind of did it on our own and we had just come to America. I got married in England, lived there a long time. My husband is English and we came over right after my son was born. He was about 6 months old. A year later, he's diagnosed. He had rhabdo. His outlook was not good. We went to Mayo and my husband's first job here, which wasn't well paid, we were locked into because of what healthcare used to be. And so for almost 40 years, he was tied into this crappy, ill-paying job, but it had insurance. Well, we had at one point about $300,000 of copay debt that we didn't know how to handle. We just made our little minimum payments. And it wasn't until after he got through his treatment and he's still living. He's not living a life, he's alive. There's a difference. And we are still in debt, up to our ears in debt because of caring for him. Our resources are limited. He's on Social Security because he was too young, that they didn't want to give him disability. He got sick again in college, so not cancer, but it was due to his treatments, which have ongoing effects, radiation, And so now we're struggling all the time with trying to take care of him. We're trying to retire. That's never going to happen. My husband's 70 now and working really hard and in a different job, but we're just like drowning and trying to figure out what to do next. And then when he had to have an emergency surgery, and I didn't qualify for the Ronald McDonald House at Mayo anymore because he was out of age, and I couldn't find help anywhere else because I couldn't afford a hotel. And so I slept in my car that night, and I'm the one who goes. My husband stays home and works and feeds the cats. But we have all these long-term financial hits that we're finding really hard to navigate because we're not actively fighting cancer. We're actively fighting all the after effects, the long-term effects of cancer, which are really severe, and they're a lot. And we're still struggling to find resources like, will Angel Foundation help us if we're not actively fighting cancer? If we don't have an active, that's our next thing is we are not actively fighting cancer. We're actively fighting all the after effects. So finding resources after the effect, is like devastating because I'm thinking, well, he's a cancer patient, but he's not. Technically, he's not. So where do you find help there? Thank you.
Thank you so much for sharing that story. And I think, I will open it up to the other panelists, but just to say, the recognition and having people, having the stories shared is the first step, and continuing to make this something that people are aware of is the only way that we're going to change our system. So I guess the first thing I would say is please don't stop sharing that story. Please keep telling people about the challenges so that while it may, so that the next person that has that experience doesn't have to go through the same thing that you did, that they can find out sooner rather than later about the wonderful services that we have in the state of Minnesota to help people navigate this by telling your story. So I think that was just the one thing I'd like to comment on and say thank you again for sharing. Do you have anything else?
And I echo that. Thank you so much for sharing that. And it sounds terrible to say, I'm sorry. Such a small 2 words to encompass how I'm sure all of us are feeling for everything you and your family have gone through. There are, so Cancer Legal Care, we are here for folks affected by cancer. So they do not, nobody needs to be in treatment currently. They can be many years out. We've worked with many adult survivors of pediatric cancers for the exact reasons you're talking about, the late effects of cancer, the secondary cancers, the cognitive issues that come up in the workplace because of cancer treatment all those years ago. So, but you know, there's a strategic piece for this debt. It's unsecured debt, medical debt, and it is dischargeable in bankruptcy. And so that is a very strategic way to look at the rest of your lives going forward, is to really speak to a bankruptcy attorney about how to get all the unsecured debt finalized and taken care of at once. So, I mean, just that is sort of the broadest stroke option out there for folks in this kind of situation.
You had asked about Angel Foundation, and I know that we know that we provide financial support around medical debt. So with financial cancer care, it supports folks who are up to 2 years out from active treatment, and it's a person with an adult cancer diagnosis. So in our case, I wouldn't be able to support you, but I am so I share in sentiments with Helen and Lindy. Just thank you so much for sharing your story, and I think there's power and there's safety in this room because folks can understand that the experience that you're sharing, and I think it's so powerful to continue to advocate and to say, because you're not alone. I'm sure that there are many people out there who are struggling with this, and even with financial cancer care, arguably it's not just support. I think inevitably we might look at moving beyond just even 2 years out from an active cancer diagnosis. There's still a lot of impact. And I think there's need for more research around what that impact looks like for folks, because we're seeing younger and younger individuals getting cancer, and they have young families. And so what is the impact to the children? We're also, you often hear of the stories as well as folks postponing retirement and things like that as well. So it's important to continue to raise our own unique experiences so that we can advocate for it. So thank you so much for sharing.
So we have about 5 minutes left. So I'm just going to ask our panelists to really briefly just share one key takeaway that if you remember nothing else about this session, that they hope that you can bring with you throughout the day and into your week.
Okay, I'll start. Repeat after me. I have trouble paying for my care.
I have trouble paying for my care.
That's it. Just say that and say it again and again. People will listen.
I love that. Yeah, I think for my the takeaway I'd have for you is, I see often enough, we see when folks come to us for support, it's really they're feeling like they're on their last leg, and they don't know where else to turn, and we want to be there for them before that point. And so it's sometimes I would just say, seek support. Oftentimes people feel like programs like Angel Foundation is offering support, and it feels almost like you're being offered something for free, and it feels icky, or that maybe you potentially there's labels depending on what communities you come from, and your lived experiences. Sometimes there's a negative connotation to what is a welfare recipient. And I would say to just dispel that. There is a lot of stigma around the financial toxicity component of cancer treatment, and we got to move beyond that. And so, as both providers and a community organization, as well as patient and survivors, to have that conversation together about managing that financial debt, and also managing the mental health aspect of it, right? The stress and the anxiety imparted because of the cancer diagnosis.
And I would just say that you're not alone. Even though it feels very alone and isolating, you're not. The numbers show that nearly everybody with cancer is facing some scale of these issues. And, there's so few oncology social workers out there. And so that's why it's really important to talk to so many people. We had somebody reach out to us she'd met a lady in the grocery store who they recognized they were both going through treatment together, and they struck up a conversation. And, that's where the client learned about cancer legal care. And so really, just know you're not alone and that there is help out there. And if you talk to one agency, we refer to Angel Foundation all the time. They send folks to us all the time. So when you sort of get into this community here in Minnesota, we all really are connected to each other in the cancer survivorship community, and we'll help you get to the next helpful place.
So as we wrap up today, you took the words out of my mouth. What I wanted to say as well is you really aren't alone. And I can say I've had some personal experience over the last year from family working with each and every one of the organizations that are here represented today. And they really are a great resource for our community. So please don't be afraid to reach out to them and know not only are you not alone, but they are really good at recognizing people's unique situations and seeing you and your family as a person. So thank you for being here today, and I hope to see you all at lunch.